Well, you are certainly in the midst of one of the most important, emerging, really hot areas of not only oncology care, but medical care in general, this whole idea of nurse navigators. So it'll be interesting to talk about the roots of navigation, you know, where it began, how it began, the evolution, and also how do you differentiate disease-specific navigators, lay navigators, social workers who call themselves navigators, what their role is, because the distinctions are really important.
Well, let me start with how navigation evolved. I think historically, when you look back and you look at even President Kennedy's vision of the right to choose, the right to safety, the right to be heard, the rights, fundamental rights. And what happened historically was the President's Cancer Panel, Dr. Harold Freeman, at Harlem Hospital, was looking at patients who had abnormal mammograms. And what he did was assigned lay navigators to women who had abnormal mammograms, and then there was a control group. The women that had navigators were 85% more compliant with following through on diagnostic imaging and testing than the women that didn't have that kind of support. So really, it really was started to reduce healthcare disparities and to really help poor and low-income patients really have access to services. Now what's emerged in our society is more complex treatments. I was giving a talk years and years and years ago, and I'll never forget the slide, the old slides before PowerPoints, and the slide said, my daughter is underneath the care of a neurologist, a pediatric neuro-oncologist, a radiation oncologist, a pediatric specialist, and I don't know who my child's doctor is.
Yeah, who's the team leader?
So I always tell patients that to look at me like they're GPS, that I'll help navigate them through the whole pathways. Complexities in cancer care now, patients don't really know who to call, when to call, and just traversing the whole medical system, as you know, can be incredibly complex.
Well, and now you've got these multidisciplinary medical teams and the inclusion of technology and technologies that are advancing rapidly, and so more than ever trying to stay on top of all of this and identifying what hospital or cancer center or institution is doing what research and what innovation. This is very complex, and when you're facing a serious illness like cancer, you're already overwhelmed. So how do you begin to make these decisions?
Well, I tell patients that getting a diagnosis of cancer is clearly an emotional emergency, but it doesn't necessarily mean that it's a physical emergency. So having the perspective for patients, or allowing them to take a deep breath and really map out the best place for them to be, I think takes a great deal of patience on the navigator's part and skill, and enabling patients and empowering them to make decisions that are going to affect the rest of their life.
So my question for you is, based on the roots of patient navigation then and patient navigation today, where are the fundamental differences, and how do you define patient navigation in the year 2010 different than it was originally with Dr. Freeman?
Well, I think there's a place for all navigators. In other words, I think that there are lay navigators that work in Native American communities and Aboriginal communities that are really trusted natural helpers, if you will, in that community. I could no more go into an Aboriginal community or the Native American community and be perceived with the same level of trust and understanding. However, if you marry, if you will, that navigator, lay navigator with a professional navigator, then you've got a great team going on. The professional navigation is composed of two different components. One's a social work navigator who has a very different skill set than a nurse navigator. I would submit a bias that I think that you have to have an oncology certified nurse, in my opinion, to be an oncology nurse navigator. If you begin with that, then there's an inherent comprehensive understanding of oncology care within that certification process. And the Oncology Nursing Society is looking at this. And the navigation is now the buzzword, and so the American College of Surgeons and the National Coalition for, or the National Consortium of Breast Centers that's accrediting mammography centers is on their standards has patient navigation within that standard, or a standard that you must meet, I should say. In my opinion, the difficulty with that is that, unfortunately, many positions can be used as marketing tools and not necessarily because of an institutional awareness.